All right, then we are going to move to our 9:30 timed item. Sorry, because we have lots of people here, I don't want to wait, Matt. And this is the Homeless Services Funding Overview and Program Direction. Good morning, gentlemen. Looks like they're all men.
Good morning. All right, well, good morning, Chair Gore, members of the board, Jeff Merriman with your CEO's office. Joining me today is Dr. Rob Oldham, your Health and Human Services Director, and we're here to discuss homeless-related contracts, services, and outcomes. So before I continue, I'll read the two actions into the record. Number one is to receive an overview of homeless services funded by the County General Fund, as well as those supported by state and federal funds assigned to Placer County. Number two is to provide staff with preliminary guidance on potential adjustments to County General Fund supported homeless programs. So to start things off, we will be beginning today's discussion by briefly looking at the history of homelessness in Placer County, touching on some key events, takeaways, and metrics. We'll then move to funding, followed by local service outcomes, and finishing with staff recommendations and board discussion. So to start things off, I will pass to Dr. Rob, the historian on homelessness in the room.
Thanks, Jeff. Rob Oldham with Health and Human Services, and sorry, I'm still a little under the weather with my voice, but it is coming back. So, but I'll try to save it for today. I'm backed up today, literally looking over my shoulder is our HHS Assistant Director, Raul Martinez, who has been helping a lot on homelessness as well. So Daniel and Jeff asked us to partner on this item. One, because HHS has a number of a number of programs that have a nexus to homelessness, and so we could better describe the detail behind some of those programs. But secondly, as Jeff alludes to, we've been working on homelessness in Placer County for a little bit longer here, me for a little over a decade on and off, and so to provide a little bit more historical context and about how we got here. So let's see. The next slide is a busy one that has a timeline of some key events and reviews on homelessness over really the last decade or so. And maybe we have about 30 minutes and 19 slides today, and spend a little bit more time on this one, but not too much. But we can go back to any of these. I know I've had conversations with many of you about kind of the more lengthy story of how we got here on homelessness. But this timeline, I'll point out a couple of key events. First, kind of looking at the first event, April of 2015, and maybe even a little bit of prehistory. So prior to the Marbut study, most of the, I'd say, countywide strategic planning or planning around homelessness was done by our Homelessness Continuum of Care, the Roseville-Rockland Placer County Continuum of Care, which is the HUD designated entity. It's an 8-member board, so Placer County has a seat at the table, as do some of our cities and homeless services organizations. And so previously they were kind of doing most of the planning countywide around homelessness, but I think a number of factors, including increased encampments, including here at the Government Center, but also in Roseville and other areas, and more talk about potential emergency shelters, permanent shelters, as opposed to just the nomadic shelter, which we had previously, inspired this board, or the Board of Supervisors at the time, right when I was coming here, actually from Fresno County, to commission this Marbut study to really look at homelessness and look at were there things that the county could be doing as an entity more to address really gaps in services. So that was the Marbut study, really presented. He was a subject matter expert, continues to be. In fact, ended up becoming the federal homelessness czar in a previous administration, but really looked at gaps. He was a subject matter expert and really came in and told the county, here's some ideas of what you should do, and you'll see the subsequent, a lot of the points after that, including the opening of the Mid-Placer congregate shelter just a few months after that report was presented, and many of the other things that happened in the next several years were in response to the Marbut report, kind of filling in gaps in services. And so maybe the other thing I'll point you to when we came to the board with a review is looking at the regional homelessness response project. So in April of 2023 is when the initial presentation, the final presentation in November of 2023. This was a process that actually kicked off in July of 2021. Commissioned by the Board of Supervisors. So it may be in contrast to the Marbert report, which was a subject matter expert coming in and kind of telling us what we should be doing and focusing on gaps. This was more of a process where we engaged with especially the city partners who I think had not been really included in the previous Marbert study. And so I point that out because we'll refer back to the regional homelessness process later in the presentation. One other thing I'll point out, increasingly there has been state funding in the last several years to address homelessness. So previously, I mentioned most of the funding coming through the federal kind of the COC. So increasingly a state focus with opportunities including home key dollars, some COVID-related dollars, and whole person care. And so with that, increased acceleration, we were already doing things like permanent supportive housing, but acceleration of those, which put some pressure, and we ended up putting citing some housing in places in communities that historically hadn't had housing cited there. So I think that inspired this the desire to really work as a region and come up with some shared goals, but also just as you'll see, the other key events in June of 2022 started to really get more questions about what we're going to be addressing today. Where are the investments in homelessness going? So not just looking at service gaps, but looking at the funding and better understanding the whole funding picture, where this going, and looking at really accountability and efficiency in these services. So with that, unless there's any questions, I'll move on to the next slide. And this, I'll stay in history for maybe one more slide, and then get into the present. This slide really drilling down in that regional homelessness response project that it developed, like I said, as part of that process involving the cities. We developed some shared siting criteria for housing. And then developed a South Placer Navigation Center concept, which included a 1-year regional residency for eligibility, 180-day maximum length of stay. And then we developed, as I mentioned, regional principles for addressing homelessness, which included decentralized, distributed housing and services, interjurisdictional information sharing and collaboration while retaining local control and accountability, and balancing compassion with accountability. So getting to the present, or at least the latest point in time count. So this is the point in time count is, I mentioned, our Continuum of Care, and actually the 501c3 that is the administrative entity for both the Roseville, Rockland, Placer County Continuum of Care and the Nevada County Continuum of Care is the Homeless Resource Council of the Sierras. And so they administered the last point in time count for which we have data was from 2024. Again, this is one night in late January, counting the number of people who are actually literally homeless, not at risk for homeless, not doubling up, but literally homeless. We had a total of 702 people who were counted, 366 of those unsheltered, and as you'll see there, the majority of those who were unsheltered living in South Placer. Looking at trends over time, since 2020, homelessness in Placer County has actually slightly declined, whereas statewide rates have increased rather dramatically in lots of other jurisdictions around the region. They've seen dramatic increase in homelessness over that time, whereas we've seen a decrease. In fact, Placer County now has the second lowest rate of homelessness among all California counties. So talking about, before I talk about the funding, just understanding kind of how the range of services, the continuum of homeless services, we think about different service categories, and actually these categories were approved by the participants of the Regional Homelessness Response Project. So first you'll see on the left prevention, which includes things like rental assistance, eviction prevention, and job training. Crisis support, which includes things like shelters, outreach workers, behavioral health services, and then housing, things like interim and permanent supportive housing. And so finally, getting to the actual funding sources for our homeless services. And so this slide really has, see the two pie charts here, and maybe I'll start. I think most of the presentation today will be focusing on the pie chart on the left, the county general funded services. But from HHS's perspective, we really focus more on the ones on the right, so the state and federally funded services. And so just as a refresher, HHS, we're a department, wide range of different disciplines that we focus on. Over 100 different programs, largely about 5/6 of our funding coming from the state and federal government. So about a $300 million annual budget. We have about 700 different contracts, both revenue contracts, getting money, where we have a contract with the state and federal government. Often it has a lengthy scope of work with performance metrics and things that we have to meet, but also we have many contracts with vendors. So some of these programs we run ourselves with staff, and some of them we contract out, and often we'll do a little bit of both in particular things. So for these state and federal funding services, that on the right, that's sort of how they're divvied up. These are the ones, the $12.9 million of that $300 million budget are the things that we think really have a strong nexus to housing and homelessness. So again, out of a budget of $300 million, it's a pretty small percentage, but it's still significant. You'll see there maybe starting at 12 o'clock and on the pie and moving around the clock. First, the largest bucket, if you will, of state and federal funded services is permanent supportive housing. I know we've talked with your board here in the last few months several times about permanent supportive housing. This is the permanent supportive housing is probably the one service that has the best outcomes and also comes with the most funding from the state and federal government. Those two are probably closely linked. I think the funding kind of following the fact that it has very strong outcomes. So about 85% of people in permanent supportive housing remain housed after 2 years. So we'll show kind of some other outcomes from emergency shelters and others that aren't quite as strong as that. So this has grown over time. So the sources of permanent supportive housing come from different places. Historically, things like HAP, or the Homeless Housing Assistance and Prevention Grant, and Emergency Services Grant, or ESG. Recently, Home Key has been, to the state, has been a huge source of support, both for capital costs for permanent supportive housing, like these Home Key projects, the hotel motel conversions, but also ongoing operational support. The next one going down kind of around the clock, intensive case management. This one actually was larger in the past. So it mentioned in the timeline whole person care, which is a program that went away in 2022. So it's been, I guess, 3 years now since we've had the Placer County has been operating whole person care. That was a pilot program. So we had more really case management, care coordination, different bundles of service. Medical respite was also under whole person care, and so actually Placer County for the last 3 years has had nothing to do with medical respite. So that's been the managed care plans, the Medi-Cal managed care plans administer the medical respite benefit, and the capital costs for medical respite. And I know that came up with the medical respite project in Lincoln are funded through that project through CCE, which is in the State Department of Social Services. So things move around quite a bit. Whereas we had a role in medical respite before and had contract for medical respite under whole person care, we no longer do, and haven't for over 3 years now. So intensive case management now largely is funded through Medi-Cal, and I mentioned the Medi-Cal managed care plans are taking a lot of that, where the county can choose to contract with the managed care plans or not, but it's actually increasingly more community-based organizations who are contracting directly with managed care plans to provide intensive case management, whereas the county really has a role. We're the behavioral health carve-out plan for managed care, so focusing on people who have serious mental health conditions and providing intensive case management for those people, including those who are homeless or at risk of homelessness, I think is in the future what we're going to be focusing on, as opposed to a much larger target population. The next one, looking at homeless prevention. These programs, while not the most robust, we have lots of different homeless prevention programs. I think we get a lot of bang for our buck here. That these are programs that serve a wide swath of people. So we talk about the point-in-time count of about 700 or 702. The number of people served by these types of programs is much larger than that, probably 5 to 10-fold larger. These are people who not just who are at literally homelessness on one night in January, but throughout throughout the course of the year, but also people who are at risk of homelessness. So some examples, mentioned a number of different homeless prevention programs. There's the CalWorks Housing Support Program, which is funded through the California Department of Social Services, or CDSS, so $1.2 million annually. It provides rental assistance, housing navigation, case management, and financial aid for families in the CalWorks program. Covers things like security deposits, utility payments, moving costs, interim shelter assistance, legal services, and credit repair. Next, the Bringing Families Home program, also funded through CDSS, $542,000 a year. It aims to reduce homelessness in families within the child welfare system and support family reunification. It offers financial assistance and wraparound services, including rental aid, housing navigation, security deposits, and eviction prevention. Next, the CalWorks Mental Health Services, also funded through CDSS, $324,000 annually, provides mental health support to CalWorks participants to promote housing stability. The Home Safe grant, CDSS funded, $214,000 annually, helps individuals in adult protective services avoid homelessness through case management, financial assistance, eviction prevention, landlord mediation, and home safety improvements. Next, the CalWorks Temporary Housing Program through CDSS, $167,000 a year, offers emergency housing assistance for up to 16 days per year, provides rental assistance for security deposits, last month's rent, and up to 2 months arrears to prevent eviction. Next, the CalWorks Family Stabilization Homeless Program through CDSS, $136,000 a year, supports CalWorks families in crisis with intensive case management and frequent contact with employment service counselors. Next, the Transitional Age Youth Transitional Housing Program, $123,000 a year, helps young adults age 18 to 24, especially those formerly in foster care or on probation, to secure stable housing, and enhances coordination between child welfare services and community resources. Next, the CalWorks Substance Abuse Services, $110,000 a year, provides substance abuse support for CalWorks participants to aid in housing stability. And finally, on prevention, the Transitional Age Youth Housing Navigator and Maintenance Program through the HCD, $73,000 a year, provides housing navigators to assist young adults in finding and maintaining housing, overcoming barriers, and improving service coordination. So a lot there, but just wanted to give you a sense of that lots of little pieces of that pie that go in to make up the 2.9 million, which we didn't want to put all those pieces in the one piece of the pie because you wouldn't have been able to read those. And finally, on the 1.3 million in housing vouchers, which also has a number of specialized key voucher programs. I won't read those to you in detail like I did with the homeless prevention, just in the interest of time, but includes Veterans Affairs of supportive housing, our mainstream vouchers, the emergency housing vouchers, and family unification program vouchers. So, and then finally, interim housing, the smallest piece there at the top, is $310,000 for our Casa DeWitt transitional housing. So interim and transitional housing are kind of used interchangeably. This is one that the federal funding, there used to be more federal funding for interim or transitional housing, and that has really dried up. And so this is a program we love to share more, expand that. But right now, citing these is very challenging. So this is at the government center in one of the old barracks, and just there's not a lot of funding for, similar to emergency shelter for interim housing, but a little bit of funding, at least through state and federal dollars, for interim housing. So that's a lot on the right side, and I'm happy to provide more detail. And I think we have, but it's maybe outside of the scope of this report. We really want to focus today on the ones on the left, the county general funded services, so $5.7 million. Includes outreach, including the homeless liaison team of $2.3 million a year, our emergency shelters, $1.9 million a year, and the managed encampment, or MTS, of $1.5 million a year. And I'll have one more slide, and I'll turn to Jeff to really go into all those in more detail. So just wanted to end with this one, the financial accountability and contract monitoring. So each county contract is assigned a contract administrator manager who's responsible for monitoring a whole host of different things, including adherence to contract terms, appropriateness of expenditures through contractor invoicing and supporting documentation, and really stakeholder feedback. So meeting with stakeholders on a regular basis and making sure things are going well. So I mentioned within HHS, we have about 700 contracts, and so it's largely our program managers who also supervise, can be dozens of staff and have usually dozens of programs that they'll be monitoring like this. The entities, including the county and its vendors that expend $750,000 or more, actually for this fiscal year, that's gone up to $1 million or more of federal financial assistance in a fiscal year, are subject to the Single Audit Act, which requires a comprehensive audit by an outside accountant. So before I hand over to Jeff, I want to see turn to my backup here, Raul Martinez, to see if there's anything else that he'd like to add.
Maybe just one thing.
Yeah.
If you could just back up on one slide. Good morning, Raul Martinez, HHS Assistant Director. Maybe just one final point, since Dr. Oldham spent quite a bit of time on homeless prevention. The programs that are listed there, sort of the many programs, they tend to support primarily young adults, especially those that have had experiences in child welfare and also at-risk families that are supported through the California Department of Social Services as well as the California Department of Housing and Community Development. So primarily you see lots of families and children who've had experiences, also experiences within the child welfare system. So thanks.
Thank you, Raul.
All right, so I do want to take a minute or two to touch on the county's outreach and homeless liaison team. As you saw just a few slides ago, this is the biggest piece of that local general fund pie. But this team really plays a pivotal role in the success of the county's approach to homelessness and really the shelter's success as well. So this team is comprised of 4 deputy sheriffs, also referred to as homeless liaison deputies or HLDs, 2 deputy probation officers, and 8 staff from HHS with a mixture of different positions and roles. This team meets with TGI monthly to review shelter issues like problematic guests, for example, and also helps to case manage guests who also have a nexus to HHS in those shelters. I do want to note, you're looking at the figure on this slide. This seems like quite a bit of contacts and calls for service. I want to note that of the 7,378 contacts, 374 of those are to the Mid-Placer shelters directly. That does not account for calls of service related to the shelter. So for the overall North Auburn area, calls for service related to homelessness and/or transient issues account for 26% of total calls in that area. For comparison, the rest of the county, so from Tahoe all the way to West Placer, similar calls account for 4% of total calls. So, I really just want to highlight the impacts to the Mid-Placer area by having kind of this centralized approach to homelessness and some of the impacts to our law enforcement stakeholders as well by having this model.
Jeff, just for clarification, is that an annual number?
Yeah, that is for fiscal year 20 through 24.
Thank you.
All right, so I'm breaking down some of the metrics for all shelters. We can see here that on average, the shelters are either close to or at capacity, with congregate being the highest at 96%. Congregate also has the longest length of stay. However, in general, we can see from the graph on the right that at 90 days, about 80% of all guests exit the shelter. One thing to consider is that both Mid-Placer shelters rely heavily on housing, with almost half of all guests in the Mid-Placer shelters housing ready, but no housing option to go to. So this obviously plays a significant role when we get beyond 90 days and start looking at those long-term guests that don't have a housing option. So in looking at admissions and exits, I do want to note that the main difference with admission to the congregate or MTS is that the MTS, the mobile temporary shelter, does not require a sobriety test for entry. While there's no formal residency requirement in the contracts for either shelter, the HLT team and TGI have worked together to formalize a 2-week residency requirement, really relying on the HMIS state system for verification. And we'll touch on residency a couple more times too in the presentation. So for exits from the shelters, we can see here that for Mid-Placer, the majority of guests exit due to noncompliance, so i.e. breaking shelter rules or violence or something to that nature. Those who moved on to housing options are covered in the kind of whitish color there, and light green figures. One thing I'd like to note is that you may be looking at the nomadic shelters saying, well, nomadic has great results compared to the emergency shelters. Why is that? So when we look into that, really the nomadic shelter takes families. Families have much more resources. They're much more successful at finding housing. And then another thing to note with the metrics here is that when a family, let's say a family of 4, finds housing, that's 4 people that have found housing, not just one family unit. So that does play a role in the figures you're seeing. So I just wanted to point that out. So to summarize the exit data, most who exited the mid-placer shelters moved to a place not meant for habitation, i.e. back to homelessness, with a higher success rate in the congregate shelter as compared to MTS. And as Dr. Rob pointed out several slides ago, this is not really surprising. We know that permanent supportive housing and other housing options have higher success rates. So just want to point out that this is somewhat to be expected, that these numbers are going to be a little on the lower end.
All right, and I'll have a few other slides just to talk about the takeaways. As we've already described, the shelters and encampments do have an important role. They provide centralized locations for unsheltered individuals, facilitating service delivery and housing support. And then in addition to the individual outcomes, which I mentioned are not as strong as with some other interventions, but they can help to address community concerns such as blight, safety, public safety, and public health concerns. As far as housing sustainability, as I mentioned, according to research, that permanent supportive housing actually delivers better long-term outcomes than emergency shelter or managed encampments, and that therefore state and federal funders, and I'll add philanthropy too. We've gotten some private investment in permanent supportive housing over the years, given the superior, really strong evidence basis supporting that intervention. And Jeff mentioned the admission criteria. So the mid-placer shelter really does not have a formal residency requirement described in the contract, other than that utilizing HMIS, which is for our HMI local Continuum of Care HMIS system is specific for placer people who declare themselves in Placer County, if you will. But guests must be clean and sober upon entry, and then for the mid-placer managed encampment, similar criteria as far as residency, but no sobriety test is required on entry, and substance use is prohibited on site. We mentioned the regional process, the emergency criteria articulated during that regional process. These were developed really for a potential South Placer Navigation Center, but the question is, could these apply these here to the services at the government center? So having comprehensive supportive services, which I think we do at the government center, have a lot of these services in place in close proximity, but also in the regional process articulated admissions criteria, including referral based, so only via law enforcement or designated agencies, as opposed to just people walking up, showing up and walking in. Behavioral health assessment being required, but not a sobriety test, really based on people's behaviors. So if they're intoxicated and can meet certain behavioral norms, then maybe we would go ahead and serve them. And then a regional residency priority, so priority for individuals with at least 1 year of regional residency, not just in the county, but kind of the South Placer was saying we only want to be serving people who are coming from our South Placer region for a South Placer Navigation Center. And then short-term housing and services available for those with less than 1 year, to try to move them on to where they're coming from, but giving them some services and supports. Exclusion criteria actually very similar to what we see at the government center, but length of stay, a standard limit that was articulated of 180 days, which is certainly not something that we have in place right now. 180 days, but with some flexibility for individuals who are needing more time to stabilize and locate housing, particularly given we have limited housing resources. So I just present maybe the staff assessment from the HHS's, the state and federal funded programs on permanent supportive housing, just to say that we do hope we're successful on the latest Home Key Plus application, which has been submitted, but we also are anticipating future rounds of both Home Key and maybe other funding for permanent supportive housing, and so we do intend to have another competitive procurement process involving key stakeholders stakeholders, including our cities, once again, as they've been in the past, when we do those permanent supportive housing, ask for another contract. I think there was mentioned before in public comment, we actually did have a competitive procurement for all the home key projects, but I think it's due for another round. So if we have new home key projects, to do a competitive, yet another competitive procurement. And when we do that, that's an opportunity to include pay-for-performance metrics. And so, by the way, pay-for-performance is not only hard for me to say, but it's something that increasingly, in healthcare funding, has been with it for a long time. So when I work in the healthcare sector, in the private sector, increasingly your doctors and hospitals are being paid not just on the number of services provided, but on how they're doing based on their outcomes. And so increasingly the majority of the healthcare dollar coming from the federal government is being for actually performance and not just for utilization. And so this under whole person care, which our target population was people experiencing homelessness, actually chronic homelessness, who had lots of other complicating factors that were causing their health conditions to be very expensive, but also having poor outcomes. We were paid pay for performance, and we actually, as a county, did really well. We met 100% of our pay for performance metrics. So we're excited about, in all of our HHS contracts, beginning to include more pay for performance metrics, including in permanent supportive housing. So that might include timely completion of capital projects, remaining under budget on capital projects, following the siting criteria that were developed during the regional homelessness response project, and again, having key some metrics around key stakeholder satisfaction. So, and then I'll hand off to Jeff.
Yeah, so to continue where Dr. Rob left off, so staff assessment for the shelter contracts, in the 2 years that we've had these contracts, we've not found any evidence of fraud or misconduct or any contractual issues. These contracts also came about in a competitive procurement process in 2023. And during that time, we've identified opportunities to strengthen these contracts and continue working with the vendor to have the best outcomes for our guests who are in those shelters. Some of these metrics, as Rob had mentioned before, would be around residency requirements, length of stay limits, and improving exit results, as well as increased communication with stakeholders, neighborhoods nearby, et cetera. All right, so to get to the recommendations, so recommendation number 1 from staff, the mid-placer shelter contracts allow for 2 two-year extensions if the contractor has been in compliance with the contract. Given the aforementioned, we would ask that the board direct staff to initiate negotiations for a new or amended contract with our current service provider for mid-placer shelters to include negotiation on administrations and exit criteria and program requirements in the shelters to enhance the services that the guests in our shelters receive. Number 2, we recommend that the board direct staff to participate in regional efforts to address countywide homelessness by identifying opportunities to enhance programs and continue participation in regional meetings, such as the Local Government Advisory Committee, Continuum of Care, etc., to identify sites for additional shelter and/or permanent supportive housing options. And that concludes our presentation. We're happy to answer any questions.